So, Dr. Khadeja Johnson, thank you so much for joining us on Support is Sexy today.
Thanks for having me. I'm happy to be here.
Absolutely. So I know one of the ways that I've mentioned to you that I came across you and your incredible work and found you was a friend of mine was considering whether or not to take her son to a regular doctor's appointment. And she was doing some research and came across this video that you posted, a very heartfelt, touching, and as I told you, the video that really resonated with me the most out of all that I've seen, of someone who is also a healthcare professional, but also a mom, sharing why we all need to listen to all of these things about all the directives really about social distancing. So can you tell us what made you decide to post that video, which at the time, right now, I think it has over 50,000 views?
Yeah, so I decided to post that video after 2 weeks of being on my patient service rotation where I see patients that are admitted into the hospital. And during that time, it was March 1st through March 15th, and we were just starting to get people with COVID-19 in the United States. And we didn't have any cases in Georgia yet, but we were very, very anxious and afraid of it coming to us and how that would actually look. Once we first did get our first case, things got very, very real. We were hearing a lot of people, our politicians, saying that, keep going with life as usual. But when you looked at what other countries, it was let's stop, let's not do anything, let's isolate and lock this down so we can prevent the spread. I decided to post the video when I realized that people weren't socially distancing, that they were out normally and about. That weekend, when you looked at the Beltline in Atlanta, there were a lot of people out in the Beltline.
Right.
And when you looked at the pictures of the cherry blossoms in DC, people were out enjoying it. They weren't socially distanced. It was packed. That day, I also woke up around 3 o'clock in the morning and saw updates on Facebook. So I saw that there was a Jack and Jill mom who passed away. And I'm in Jack and Jill, so it really hit home. And then she was a nurse, and as a healthcare provider, it just became very, very scary. Like, this is real. This is scary. We need to change our behavior.
And do you think people maybe at that time, especially maybe now a lot of us know more information, but also at that time we were getting those mixed messages, in New York, they're saying stay in this state, the governor's saying this, and this state, they're saying that. So do you think that might have been, of course, this is our best guess, might have been a part of it too, some people, or the idea that you only get it if you're over a certain age, or you're only at risk if you're over a certain age. Do you think the mixed messaging might have had anything to do with it too?
I absolutely think the mixed messaging's had a large part to do with it. Some people were saying it's only a mild flu. And, most people will be fine with the flu. This is maybe 20 times more deadly than the flu. And that message wasn't out there. So I thought those were really important things to let people know. Healthcare workers aren't dying from the flu like they have died from COVID-19.
That's right. Now, what was it difficult for you to, because in that video, and I don't know if this was your plan to, but I know at some points your eyes were filling with tears and you were, as a human being, emotional, just in almost what I feel like was your plea to people to understand how serious this was. Was it difficult for you to get to be that vulnerable in that moment?
Absolutely. I did not expect to get that emotional. I am a very stoic person. I like to state the facts, this fact, this fact, this fact. And I like to leave some of the emotion out of it. I don't like to be seen as emotional. So it was very difficult for me to actually post something where I got so emotional.
What do you think it was that sort of brought those things to the surface? Do you think, it could be a combination of things, right? Exhaustion and reality, and I'm sure a bunch of different things, but what was it, do you feel like, looking back for you in that moment?
So looking back in that moment, that's when I was talking about some of the conversations we were having at home. It's hard to let someone that far in knowing that we may lose people that we love. I found that those individual conversations that I was having with my loved ones about how concerned I was for them and their safety, and maybe they're fine, but their parents, their in-laws, their grandparents, that we really are going to lose people that we love.
Mm-hmm.
That idea is very sad and hurtful, and it's hard to think about, but it's real.
But it's real. And that's what they say, every one of us around the world, but in the US, especially now that we have, I think, the highest number of cases at this point, or positive, what is it? Positive people who have been shown to be positive with the coronavirus, COVID-19, that everyone's going to know someone or know someone who was affected by this in some way. And I think, like you said, in the simplest terms, it's hard. And also for everyone listening, it's okay to feel just as you did some kind of way about that, right? Like it's difficult, it's emotional. I know some days I'm usually very much, like you said, a stoic person, even though I'm a Pisces, so I'm sensitive. But very much about go for it, go for it. And I've just been feeling kind of sluggish some days. And it wasn't until I spoke to someone who I work with, she happens to be a therapist. She's a client of mine, but she just talked about the uncertainty. Robin Stone, who actually did a conversation with us, that the uncertainty is a big part of the trauma of this whole experience. And that's what, and I'm just like, it just made so much sense to me. Like, right, it's overall sad, but there's part of this that is traumatic and losing other human beings and seeing those stories. So it's normal to feel about this.
Yes, it is normal. It's normal to not feel okay right now.
It's not. Dr. Khadeja, it's normal to not feel okay right now. Yes, that.
If you're not a little bit scared and not a little bit okay, then you wonder, like, are you just denying it? Because it's coming. Mm-hmm. And we're in contingency plan right now. We don't really know which way it's going, depending on what state you're in. If you're in New York, it's in crisis mode right now.
Right.
But this mode right now, kind of in limbo, where are we going, what's going to happen, it's uncertain, and it should make people a little bit uneasy.
So speaking of that, what can we do then? And we'll go through some of the myths, but what is the most important thing in your opinion that all of us, everyone that'll be listening to this around the world really, can do right now to do their part to help stop the spread of the disease? There's many things. I know they gave us a list of things, but if you had to say, this is the one thing I would say, please make sure you do this.
Stay at home. Really, just stay at home. If you don't leave your house, you can't get it. Mm-hmm. If you have to, some people I have to leave my house, right? But I do take precautions when I do leave my house. I no longer go in public without a mask on. I'm going to put a mask on. When I'm at work, I use the N95 mask because there's more chance of me getting it there. When I'm out at the grocery store, I can use a surgical mask. The masks people make at home, you can use those masks. I don't touch my face. I try not to touch anything like my phone if I have to go out. Everything's in the bag. When I get home, everything's disinfected before I bring it in. I'm not touching stuff. Mm-hmm. Actually, I've been walking like this with my hands literally like this, so I don't touch.
Your hands clasped, like folded, so you remember not to touch anything. And I think what you just mentioned too, for anyone who might be panicking about not having a mask, which obviously there's shortages of masks. I've seen people like Dr. Oz and other people show you how to just make something at home. So at least even if it's not necessarily keeping the virus out, it can help, but also it keeps you from touching your face too. When you just have something covering it, it just mentally lets you know this is covered for a reason.
And then wash it when you come home, because you're not doing that many trips in and out. Put it on. Don't move it around. When you get back in the house, fold it up and wash it with your regular stuff. Mm-hmm. For those of us that can, because I know not everyone can wash their clothes the same day.
Right. So stay at home is the main directive. Stay at home. And also there's, I know in your video, and just, I think it's so important to address some of the myths. Obviously there's stay at home, but some of the other things, and I think, again, some of this might be the mixed messaging that's out there. Some of it is just, I don't think some people might be being reckless. Other people, I think some of us just want to hold on to some of the things that are a normal part of our lives. Like, I go get my nails done every other Thursday and they're still open in whatever state. So can I go if they say everyone there is fine, or going to get our hair done and those kind of things? I know you have some thoughts on those kind of things.
My thought is still to stay at home. Mm-hmm. So during all this, my biggest fear is that I could potentially have it and then I could spread it to other people. So even though I'm fine, it takes about 5 to 8 days before you show symptoms. So if I was exposed 5 days ago, I still may not get sick until 2 days from now. And before you're sick and showing symptoms, you are still spreading that disease.
You're still,
Or
right.
still
Someone could still catch it from you, even if you're not showing symptoms.
correct. So if I went and got my hair done, even if I'm the only person in that salon, they're cleaning it, I'm breathing on that person. I don't have a mask on. Even if that person's wearing a mask, I'm breathing all over her stuff or his stuff as I'm getting my hair done. So that part worried me a lot, that I could get someone sick. Or even if that person is young and healthy and doesn't get sick, they go home to their parents. They go to church, because people were still going to church at this time.
Yeah.
Get other people sick. And that, I don't know, it would be okay if I knew that I got someone sick, and now they're not here anymore.
That's right. And I think that might be something, maybe again, we might be thinking about it more, but that's such a good point. It's not even, you just spoke from the perspective of you getting someone else sick. Sometimes we think, oh, well, my hairstylist is fine, she's not going to get me sick, but you might be sick. You might get her or him sick. And then, like you said, they take it home to their family and their child or whoever. And then it just continues to spread that way. So everyone, we have to remember that staying home doesn't just mean you being protected from everyone else. It's also people being protected from you. If you're someone who doesn't know that you have, I just touched my face, that you have the virus or something like that. So that's also a good point. What would you say, or how would you say conversations with the people you love have changed for you, especially as a healthcare professional? I know you've had some very serious conversations with your 14-year-old son and just talking to your parents and those kind of things. For those of us who not only have the conversations with our children as parents in general, or people like me who have elderly parents who, you mentioned going to church. My mother, I remember before it really got serious, I was telling her, I don't think you should go to church. It's a lot of people there and it's an older community. And she's, she doesn't want to stop doing, that's her thing. Until a deacon in the church got the coronavirus and is in the ICU, and they had to close the church. Now, most churches are closed now, if not all here, right? But but it just, and then it really hit home. So what kind of conversations are you having with your son, with your family, et cetera?
So the conversations became more firm with my parents first. I usually let them do medical stuff that they want. But these were the first time that I was very, very firm with them, saying, you cannot go do your training session. The CDC says that you need to be distanced. And then I get well, it's only about 5 people. It won't be that many. I was like, no, you cannot do it. And I don't think I've ever talked to my parents that strongly. But it was, people that we love will die from this. I don't want you to be one of those. You cannot go do this. Never that strong with them, but I was, because once again, I don't want to have regrets, and I didn't want to regret not telling that to them, letting them still make those decisions on their own and live their own life. I felt I had to be strong and stern with them, and I've never done that before.
Go ahead.
Which was new and difficult.
Yeah, exactly. And I think, just like you said, it was new and difficult. And for me, I hope, God bless, I don't know if that deacon is even well yet today. And I know his wife was quarantined, but I think too, some of the realities are hitting them also outside of us telling them. Now my parents, I know, listen. I'm like, look, they said you can't do whatever it is. Like going grocery shopping, oddly enough, was a thing that my father enjoyed. They're 90. Thank God they're mostly healthy and still active in their own way. And I just told them, we can't do that anymore. Like you can't, I don't even go. So we have to order it and bring it in. So that's one of the things too, to ask you about. I have mentioned to you that I read recently today that with groceries or bringing in packages, people are ordering tons of things from Amazon and all of that. What is your system for when you get things even delivered to the house, and how that works for you? Okay. Like groceries, for example.
So I ordered Instacart for the first time, because I too enjoy going to the grocery store. It was
you do? You and my dad.
It was my time where I
right.
didn't know what's going to bother me.
Right.
So when I get the groceries, I leave the non-perishable things in a room in my house. So I bring them in the garage. I will, in the garage, kind of Lysol spray the bags, which may be a false sense of security, because I'm not getting every single inch of the bag, and I don't have that much Lysol. I leave the non-perishables, or the non-perishables, so any canned food or anything, I will leave that in the basement of my home for at least 3 to 4 days, about a week. and I'll bring up the perishables. I have bleach water that I keep in a glass bottle that I use to clean with all the surfaces in my house. I'll use that on a washcloth, and I'll just wipe everything down and put it in the refrigerator right away. The vegetables, they get a bath and a shower, so I will soak them in soap water and then rinse them.
Oh, you do your vegetables in soap water. So actually, like actual soap, and then you just rinse them and they don't taste soapy?
No.
Oh.
So this is a different topic. I knew someone, I read from someone who worked migrant. She was a migrant farm worker physician.
Mm-hmm.
That's what she says. All of her fruits and vegetables get a bath, then a shower. I don't know what she's washing hers with, but.
What do you wash yours with? Like dish soap or what kind of soap? We're really in the weeds here, but I'm so intrigued because I only eat mostly vegetables. You know, I'm vegan, or I say plant-based. So I rinse everything off, but I've never given it a bath and a shower.
Right now I'm using dish soap because that's what I have. I don't have the spray. There was no spray.
And then do you dry, like pat dry them and put them in the refrigerator, and are you doing this right before you eat it? Now, really, I'm all in it.
So always before so my son will I'm encouraging him to eat fresh fruits and vegetables. So I always will only put it in the refrigerator once it's clean.
Got you. Okay.
And I don't like to use paper or plastics or anything that can be thrown away. So I just use like tea towels.
Mm-hmm.
So I'll wash everything really well. I'll rinse it really well. And then I let it dry on the countertop. And then I just, like the lettuce, I will put in dish towels, and it keeps it nice and crisp on one flat surface.
Look at you. Not only Dr. Khadeja Johnson, but a little Martha Stewart, a little B. Smith going on over here. No, I'm really honestly intrigued because I've always rinsed my vegetables, but I didn't even think about going that far. I'm going to start doing that. And have you always done that, or this is something new since the coronavirus?
I used to use the spray. Sometimes with lettuce, I would just soak a really long time and be like, "Ooh, I pray I don't get anything." But
right,
now I've taken the soap. It tastes fine to me.
Right. Okay, I'm going to try that. We're going to see if that works. That sounds good. It's better. And I think, I'm not even going to say anything might be extreme right now. It's better to be extremely cautious, right, than extremely reckless, or just think, oh, well, I feel like we can't really brush off anything right now.
Because we don't
know.
Really, really don't know enough about this virus. Like, is it shed in our stool? Should I be eating whether I don't eat anything that I can't cook myself after someone else cooks it? So I am being extra cautious.
Mm-hmm.
It may not be necessary, but it makes me feel mentally better. I don't stress as much.
Right.
When I take those extra steps, and that's what I have to do for myself, to take those extra steps.
And speaking of extra steps, I know you said another thing that you do is social distance as much as possible in your house with your son. And that's something that, as I mentioned, my parents being older and me being here with them, I try it. We're in the same space, but you're not hugging as much, or even just touching as you walk by the person. It's sort of, there's just no affection, but you're doing it because you love them. So tell us a little bit about how you've even changed things of how you both move about your house.
Yeah. So since my son is 14, it's easier. He's not trying to get a lot of hugs and affection from me. We have taken to, when I was with patients more, so that first 2 weeks I was with them a lot. The second 2 weeks I only did one half-day clinic, so it was much less scary, and the patients were not as sick in clinic. So we weren't sitting on the same couch together. So our couch is a smaller couch. So he would sit on the couch, and then I would sit in the chair, and then we would just switch places the next day. At nighttime, we would Lysol or alcohol spray the couch down. We try to keep that distance, that his arm out, my arm out. It's about 6 feet, 6 foot distance. So.
Right. And what about, how are you doing overall? Like, just, I just really want to know, how is Khadeja Johnson doing?
Actually, I think I'm doing good. I do worry about this. Don't get me wrong, I do worry about this, but it's not something that is always in the forefront of my head. I have gone to I won't check the social media. I won't go look at all the COVID-19 studies. I do that twice a day, where I will look up the new studies, and I try not to look at too many news articles, but really, what are the medical studies doing? What are they doing in other countries? I focus so much on the numbers. It's hard because I still have a lot of loved ones and family in New York and New Jersey, so I am seeing what's going on there. I do follow that, but I try not to, focus on it too much. I try to make my household as normal as possible. So I still make my son get up, brush your teeth. School starts at 8:00. So he keeps the schedule. I will cook every day for him now, which before I was not cooking every day for him. And just trying to make it fun. We'll play video games. Like, what are those? 1, 2, 3, 1, 2 Switch, the Nintendo Switch games.
Okay, I don't know. Yeah.
We have tried to make things more
normal.
I've tried to make it normal, or even a little bit better than normal.
Yeah.
That thought that if something does happen to me, I want him to have some nice memories of me.
Mm-hmm.
If something happens, so that they're fun memories. So I've tried to make things a little bit more fun.
Speaking about something happening to you, God forbid, I don't know if we talked about it here, but that conversation with your son, just about where everything is and how to know what to do, and how did he handle at 14 having that conversation about, mom might get sick and might not come home or something like that, which is, I'm asking, well, one, obviously because of you, but also I know that's something that we don't think about with healthcare workers sometimes as well. It's just, we think about, oh, they're putting themselves at risk and, oh, they must be exhausted, but these folks have families too.
Yeah. So we first had the conversation about COVID-19 on the way to school one day. And this is when about 3 weeks ago, when it first came to the US, we were driving, and I was like, so have you heard about the coronavirus? So I always start with asking him questions and then just listening to him. And he was like, yes, I know about COVID-19. I was like, okay, so what do you know? He was like, oh, I'm not really worried about it. I read about people my age and I'm going to be fine. I was like, great. So I let him, I didn't pursue much. It wasn't until we start seeing the cases in Georgia where I thought that I should make sure that he had some place to go, someone to be with in case something happens to me. So one day on the way home from school, I said, so if something happens to me and say I get quarantined at the hospital or have to stay at the hospital, what do you want to do? He was like, can I just come to the hospital with you? And I was like, no, you can't just come to the hospital with me. What if I'm actually sick, admitted into the hospital? Where would you want to go? And we knew he couldn't go to my parents because they're at risk. And if I were to be sick with it, given that we live in the same household, it would be too much of a risk for them. So it took us a while to figure out the best place for him to go. And we figured that out. And I knew that if I would have asked anybody, they would have said yes. But once again, I didn't want to put too many different people at risk. So it was a difficult conversation to have, or not difficult conversation, difficult thought process of where the best place for him to go would be. Mm-hmm. In our household, death and dying has never been something that we have shied away from. We've made it normal. So he has heard conversations about death and dying. I was on the Grady Ethics Committee, so I talk about death and dying. It is a normal part of life. My mom's dad died when she was 8 years old. So I've always known where our will has been since I was really, really little, hers. So one day I just talked to him like it was normal. I was like, Miles, come to my room really quick. I want to show you where everything is. It's like, I know where everything is in your room. I was like, no, I have a will. The will is if something happens to me, I need you to know where it is so that you always are protected. I have a power of attorney, forms, and all the forms I want in case something happens to me. This is where it is. He was like, okay. I was like, just know where it is so you're always protected. And that's how we phrased the conversation and how I talked to him. I didn't make it a big deal. I just talked about it like it was normal.
Right. Thank you for sharing that with us. And I think that'll be helpful to other parents, even who aren't health care professionals. It's just having the, of course, you have to do it in your own way, know your children and that kind of thing, but just having those conversations. And even I think the way you started it, even in the car, of what have you heard about this? What do you think? How do you feel? Just creating space for people to have those, or your children to have those conversations with you, even if, I mean, maybe some children might be like me. Some days I'm like, I don't know how I feel. It just does not feel right. Something just does not feel right with this, right? So, Dr. Khadeja, if you wanted to tell us one thing that you wanted to make sure that everybody knew from this conversation or just in general, especially I always say I have women listening and a few good men, but anyone that you wanted to just share with it, message, excuse me, with at this time, what would it be?
I think the message would be to always use your voice. That sometimes we have self-doubt, that I'm not good enough, that imposter syndrome, but to always use your voice. This is a video that I made that I was not about to post. I actually was like, I can't post this. This is not good enough. It's not, I'm crying. This is too much. I'm not posting this. And I sent it to my mom and she was like, you need to post this. Please, please post this. And I was like, no one wants to hear this. I'm crying. This is too much. And she was like, you use your voice the way you know how, and this is your voice, posted. So just telling everyone to just use your voice and post it, it may mean something to somebody.
Wow, that's powerful. That makes me want to cry because as I mentioned, it's the reason that I reached out to you was because of that video, and I think that's the reason it resonated with so many people, including my friend who then shared it with us and me. And I'll share it here. Everyone listening, I'll have a link to the video in the show notes so you can go watch it yourself. And I love that it was your mom who told you you need to post this.
Yes.
Like having someone like that to support you and say, you know, this is a part of you too, and this is very important. So again, I had a glass for us earlier, I'm raising a glass to you. I yay, appreciate you and just all the work that you are doing, and honestly, outside of being a healthcare professional, just that you did share that message. It really put a human side to all of this. So I just think it's so important. And I just know it's going to inspire or just inspire people to use their voice and also to take not only everything we're going through seriously, but I think in a way you also gave us some hope in your message. I feel like it was, maybe I took this from it. I feel like you were sort of telling me, like speaking to me, this is how we can get through this. You know, that's what it felt like. So thank you again for your courage and for sharing. I appreciate you, and I'm going to share your message and who you are with as many folks as possible, because it's also, and as a woman of color, just seeing you too, being able to share from that perspective, I think that's why it connected to me as well. So thank you for putting that face on this as well and speaking from a place of love and concern for all of us, for everyone.
And thank you so much for what you do. Like, support is sexy. I'm glad that you are being supportive and supporting other women and people of color. This is great.
Absolutely. Thank you so much. Hold on for just a second.
Yeah. Okay.